So today we will be discussing foot drop. फुट ड्रॉप हमारे पास एक ऐसी कंडीशन है कि जब हम अपना फुट डॉर्सिफ्लेक्स नहीं कर पाते. The inability to lift the foot, the specifically the front part of the foot off the ground. तो हमारे पास ये क्लिनिकल रिप्रेजेंटेशन है ड्रॉप फुट की कि जिसके अंदर ये एक नॉर्मल फुट है जिसको हम डॉर्सिफ्लेक्स कर सकते हैं. लेकिन ड्रॉप फुट के अंदर हम जो पाँव की टोज और पाँव का फर्स्ट जो ये वाला सारा पोर्शन है इसको ऊपर की तरफ उठा नहीं पाते. So this condition is known as drop foot, or it is most common condition which occurs because of the peroneal nerve injury. So discussing foot drop, that the patient cannot raise the front part of the foot, which could be because of the weakness or the paralysis of the tibialis anterior muscle. In the foot drop, the high steppage gait is seen, and patient raises his or her thigh in an exaggerated fashion. Foot drop may occur because of the injury to the peroneal nerve at the time from its course. Now let's see that what is the course of the peroneal nerve. That just above the back of the knee, the sciatic nerve gives rise to the common peroneal nerve, which then travels anterior around the fibular neck, dividing into the superficial and the deep peroneal nerves. Now, deep peroneal nerve give innervation to the tibialis anterior muscle, which is mainly responsible for the dorsiflexion of the foot. So ultimately, either there is the weakness or the paralysis of the tibialis anterior muscle due to the peroneal nerve damage, deep peroneal nerve damage, so foot drop can occur. But there are many other reasons which could cause foot drop, which includes L4 to L5 disc herniation, where L5 will cause the nerve compression and ultimately foot drop can result. Injury to knee includes the knee dislocation, and in case of the in case if there is any knee dislocation, you have to check for the common peroneal nerve injury and the popliteal artery injury. Another condition which may cause foot drop is the lumbosacral plexus injury, which may be due to the pelvis fracture. Another reason may be hip dislocation, which may cause sciatic nerve injury, and ultimately, along all of its course, which may affect not just sciatic nerve but also cause foot drop. Established compartment syndrome is a syndrome in which a muscle cannot get its proper supply and ultimately it is being affected with ischemia. So, foot drop is a late finding in the established compartment syndrome. Reversible muscle and the nerve ischemia occur in patients if fasciotomy is not performed. 4 hours of ischemia is tolerated, but 8 hours causes irreversible muscle damage. Here are some other causes of the peroneal nerve injury, which is the fracture to the head or the neck of the fibula, prolonged external pressure as in case of the tongue plaster cast, or the severe various injuries of the knee, which may, as we have discussed, knee dislocation previously, or any surgical procedure like knee prosthesis and knee dislocation may be one of the causes of the peroneal nerve injury. We can also have the weight loss, sports specific nerve entrapment in runners, and shearing nerve injury causing common peroneal nerve damage is one of the major reasons for the foot drop. As we have discussed previously, that the sciatic nerve injury may be present, so it's another cause. Fracture of the shaft of the femur and the specifically the fracture head or the neck of the fibula may also cause foot drop. The recovery of the foot drop usually takes 1 year to 18 months. However, the big two is the fastest to recover. We have to obtain EMG and nerve studies of the patient first, and depending upon the type of the cause of the injury, different manual therapy treatments are being used. However, if recovery is not possible, then repair, grafting, and the tendon transplant procedures are also observed. Here are some exercises for the foot drop, which can actually be very much helpful, again, depending upon the condition. That ankle dorsiflexion, ankle adduction, abduction, assisted toe raises, toe raise negatives, heel raises, ankle eversions, ankle inversions, single leg stance, and orthosis. Orthoses are the equipments which we are basically the aids which help us in the movement. all those patients who cannot move their either part of the limb, they usually use orthosis so that they could provide them assistance, proper assistance, so that they may not require any other human person uh, for their support.